It's good having you here today. This is Dale Johnson for Lincoln Fire and Rescue, where we take you into the city fire department and talk about the rescue component as well, introducing you to highly trained individuals and well-organized operations that save lives and save property. Today, hands-only CPR. You're in for a lesson today. We'll start with a statistic. Between the time 911 is called and medics arrive at the scene of an emergency, if hands-only CPR had been applied by someone at the scene, it's realistic to think that 40 to 60 additional survivors would walk out of Lincoln hospitals each year just from hands-only CPR. No mouth-to-mouth, no CPR certification. So today we'll learn what is hands-only CPR, why is it different than the traditional form of resuscitation that we've all been trained and taught for years, and how effective is it? On the show today is Assistant Fire Chief Pat Boar. Pat, thank you very much. Good to see you again.
Thank you, Dale. It's always good to be on your show. Appreciate you
having me.
Hands-only CPR. Now, we want to talk about that, but let's refresh everyone's memory.
Okay.
We'll talk about the old style, the traditional style CPR.
Okay. The old style is very structured, it's actually a certified course for what professionals get. As a matter of fact, we at the fire department get that course every 2 years. And so it's a combination of chest compressions and mouth-to-mouth ventilations.
And that's been the standard for decades.
You know, they've done some changes with the ratio 15:2, 5:1, but for the most part, those two combinations have been the standard for years and years.
And sometimes it's been taught with two people. One person will issue the compression, the other person will do the resuscitation.
That's correct. They have come up with ratios and processes for if there's only one person there, one person can switch between the two. Or if you have two, the benefit of the fire department being there and trained rescuers, one can do one and one can do the other.
Where did hands-only come from?
Hands-only came from a number, well, it came as a result of a realization that some people don't want to do mouth-to-mouth. And after studying it, they realized that it's as effective, it's shown to be as effective as doing the ventilations. So if you don't really have to do the ventilations, or at least if this method is as effective as this method, let's just drop it if more people are going to be willing to do it.
That might be a demonstration of how society has changed. It used to be that if someone's in an emergency, I guess you don't think of yourself, you do whatever is necessary to help someone, but we live in a different world than when that was the thought.
We do, and we've experienced that on the fire department, that that kind of contact really isn't something people like to do today. And so we have to find ways of getting what we need to have done without doing that.
Dentists never used to wear glasses and goggles and masks and latex gloves, and now they suit up.
Now all healthcare professionals suit up to protect themselves and to protect the others.
That's the time we live in. All right, so it's hands only, no mouth-to-mouth, no resuscitation involved.
None.
Is it certified? Is a certification necessary for hands only?
No, not at all. It's not like, you talked about the traditional method where you actually had to have a number of classroom hours and you had to go through a series of practices with a mannequin and demonstrations, and then you received a certified card. None of that. You can watch a video, and it's very informal instruction. All right.
Start at the beginning. Where does a person start with the procedure?
Okay. The first part is witnessing someone going down. When you witness someone going down, there's the assumption, we're making the assumption that there are no hazards in the area. If you don't witness someone but you come upon them, you really don't know if something else caused their problem. So the first step in this process is to witness someone going down. Then you can be fairly certain that there are no hazards that might endanger you as the rescuer.
Electrical wires.
Electrical wires or hazardous chemicals or something like that.
Okay. You made that observation, nothing in danger, the person just appears to be unresponsive.
Yep. Then you observe, okay, there's a person down. I witnessed it, I go over and I shake them.
You okay?
You try to see if they're actually unresponsive. Maybe they're sleeping. Obviously, if you witnessed it, they're probably not sleeping, but you shake them just to maybe make sure it wasn't a fainting episode.
Do you talk to them?
You can. We encourage you to grab them by the shoulder and shake them. Say, hey, are you okay? Are you okay? So you want to make sure that they are unconscious.
All right, let's assume they are.
Okay.
They're having a medical episode or a heart attack.
And again, you shake them, there's no response, so they are unresponsive. And if they're not laying on their back, position them to their back, put your hands in the middle of their chest, and push hard and fast up to 100 beats a minute until a professional arrives to take your place. That's it.
Okay, middle of the chest.
Middle of the chest.
The sternum area above the sternum.
Yep, you could say middle of the chest from side to side and middle of the chest from top to bottom. You want to be on the sternum.
Okay. What do you do next?
You put one hand on top of the other, again in the middle of the chest like we described, and you push.
You lock your fingers? Necessary or overlap?
Not necessary. You know, again, we want to make this simple. So you can lock them if you feel comfortable. You want to overlap your hands so one is on top of the other. So you're getting that concentrated push at that one spot, which ideally would be over the heart, which is pretty much in the center of your chest. So again, hard and fast. 2 inches is the depth that you want to push.
That seems like a long way to push someone's chest, Pat.
But you want to compress the heart. Remember, the objective is to squeeze the heart and push the blood out into the body. And then when you lift up, the heart refills. When you push down again, it pushes the blood out. And so that process, and 100 times a minute, that's pretty rapid. It's like, if you can think of the old Bee Gees song, Staying Alive, that rhythm is pretty rapid.
Not quite 2 per second.
Yeah, not quite. But so 100 beats a minute, 2 inches in depth, and continue to do that until help arrives.
Do you position the neck in any way?
Nope.
Don't
Don't
worry
have to worry
about
it. Don't have to worry about it. One thing I forgot was we need to call 911 to get help coming. So I witness someone going down. I go over, I shake and shout, hey, are you okay? Are you okay? No response. They're unresponsive. I either call 911 or I yell to someone call 911. And then I place my hands and begin to do compressions, 100 beats a minute.
Is that the same method for a male, a female, and or a child?
It's really for adults. And we consider adults, you know, older teenagers are fine. But because we ask that they compress the chest 2 inches, that's a lot of requires a lot of strength to do that. And so a smaller child is probably not going to be able to do that. So this is adult, hands-only CPR.
If I'm certified in the traditional CPR, can I continue to use that method, or should I convert to this method only?
You can continue to use that. If you're trained and you're certified to do that, you can continue to do that. Matter of fact, again, we on the fire department, other trained professionals are still using that traditional method today.
But children, you think of it, you handle the matter a little bit differently?
With small children, if you're an adult and you witness, there are some different dynamics with children. Typically, historically, it's not, their issue is not cardiac related. It's more an obstruction in their airway or something that's causing them not to breathe. So it's just a whole different dynamics with children. So really in this process, we're focusing on adults.
What do doctors and professionals? Obviously, they've accepted the traditional. How about the hands-only?
Absolutely. Both American Heart Association and American Red Cross are proponents of hands-only, of using compression-only CPR.
Can it be done wrong? Too fast, too slow?
Could be done too slow. It could be done too fast. They may not go 2 inches, but any attempt is helpful to possibly saving that life, as opposed to doing nothing, where there's no chance for that individual.
What if there's a need to stop? Once you start, is there a need to continue until medics arrive?
We want them to if they can. There's a possibility where the medics are a long ways away, and this is strenuous activity to do 100 compressions a minute, and so you could get physically tired enough that you'd have to stop and rest. And so hopefully someone can take your place, or hopefully the paramedics are close.
You know what you've done? You've embedded the staying alive theme in my head now, is what you've done.
It's a great beat. It's a beat that we want people to know.
Is there training, Pat, or is there even a need for training? It sounds very simple.
You know, what's one of the things that we're doing this year with Lincoln Fire and the Health Department, a number of other community partners. We have this initiative, this project where we want to educate people and then to show them. It's not really training. You could call it training, but it's really showing you and demonstrating for you what you need to do. But it's again just a couple simple steps. Recognize, call 911, and begin to do it.
Shake and shout. I like that. I
shout.
picked up on that. Ask the person if they're okay, and then start hands only.
Call 911 and start hands only.
Okay. Can they get a hold of the fire department? Approach a fire station? Talk to a firefighter?
They can do all those things. We have a website, easycpr.org. easycpr.org. They can go to the website, and we have some videos there that people can watch. We have some links that they can go to get additional information.
Well, I started with an impressive statistic, and even if that is not completely accurate, underestimated, that's still an impressive. 40 to 60 additional survivors could walk out of a Lincoln hospital if someone would apply hands only right away until medics get there.
You know, and that's really what we're trying to accomplish is to increase those statistics. That's what we're striving for. And last year we had about 12% of those that went into the hospital or were found in the community with cardiac arrest. About 12% walked out. We want to raise that number. That's our mission. That's what we want to do for this community. But we can't do it alone. We have to get the community involved because, as we've talked, there's that segment of time between the time it happens and the time we arrive. We have to have the community's help in making this happen.
So, and that's you, and that's the community that watching this program right now. So, hands only CPR. You can find out more by going on a website, talk to a firefighter, approach a fire station in your neighborhood, and learn more about it. Pat, always good to have you in. Thanks for coming in and talking about hands only CPR.
Thanks, Dale. Thanks for having me. Appreciate it.
All right, and this is where you come in as a community, learn about hands only CPR, go to a website, talk to a firefighter, approach a fire station in your neighborhood. And thanks for watching us today on 5 City TV. I'm Dale Johnson.